Today is really a glorious day. I want to welcome Council members James Gray and Cynthia Hedge-Morell. State Representative Jericho Sentinel will be with us shortly. I want to welcome the Governor's representative, Christy Nichols, who is the Commissioner of Administration. Thank you for being here. Mr. Ronnie Burns, who's the Chair, and all of the other board members who have done unbelievable work in this facility. To Dr. Karen DeSalvo, our Health Commissioner, to Charlotte Parent, who will assume the Acting Director position in the New Orleans Health Department soon. To the New Orleans East leadership, to Mr. John Finan, who is the President and CEO of FMOL, who's represented here today, and to all of our friends from Children's Hospital Consortium and all other important folks that are with us today. One of the highest priorities of my administration was bringing healthcare security to the people of the city of New Orleans, and especially in New Orleans East. One of the top priorities was to make sure that we built a full-service, 80-bed acute care facility. 8 years ago, 2 hospitals in the East were destroyed. They were serving 126,000 people from Lower 9 and Gentilly to New Orleans East. They were without care. Our administration has been committed from the beginning to 24/7 care, and as soon as we got here, we got down to the business of making sure that happened. The first thing we did was opened an urgent care facility. It was opened in July of 2011. The head nurse is with us today, Ms. Alicia Pugos, who is in the audience and has told me today that they have seen 17,000 patients since they were open, all from New Orleans East. The second thing that we did was get about getting this hospital back on track. But before we did that, we had to open a primary care facility, so I reached out to the Daughters of Charity. Mr. Michael Griffin is here representing them. Sister, thank you so much. And asked them if they would consider opening not only the hospital, but the primary care clinic to make sure that it was part of the continuum of care services that had been developed under the leadership of Dr. DeSalvo and part of the 88 primary health care clinics that now exist in the metropolitan area of New Orleans. The Daughters of Charities, as always, were very focused on their mission at the time and said, we don't do acute care hospitals, but we do primary care facilities really, really well. And so they have partnered with us, and we just took a tour of the 33,000 square foot primary health care facility that cost $9 million. The city provided $3 million in funds. It opened on Monday, January 6th, on a soft opening. The official opening will be in a couple of months. But we have delivered on that promise as well, and I want to thank the Daughters of Charity, Michael, and all of you for all of the work that you have done. Of course, the most important piece to this healthcare initiative in New Orleans East is the hospital that we are standing in the midst of right now. I want to just take a minute to talk about how we got here. In July of 2010, a short time after I came into office, we purchased the Methodist Hospital site. It was a very tough negotiation. There was a deal on the table for $40 million, which in my mind was 2/3 above what the cost of it was. We renegotiated the deal and actually bought the property for $16 million, saving the taxpayers $23.7 million, which we then reinvested in the construction of the building. We also had a board at that time that was not functioning well, so I went to the legislature. We had the legislation changed. We reappointed the board, and I asked Mr. Ronnie Burns, Mr. Henry Kofson, and other members who are here today, great community leaders, to serve on that board and to provide the much-needed leadership that was necessary to get this project off of ground zero, back on track, and built on time, under budget, and ready to go. We have received $8.4 million from hazard FEMA mitigation, $15 million, Christy, from the state's capital outlay budget, and then worked again with President Obama and Secretary Sean Donovan to secure a $97.6 million loan guarantee from HUD. We are in negotiations right now with LCMC. We thank you all very much for participating with us. And FMOL from the beginning has worked with us, and we thank you for that. It is critical that this hospital get open on time, on budget, and on schedule. And as you can see, right now, you're looking at a facility that's on target to be open in July of this year. We would not be here were it not for key partners in the public, not-for-profit, and faith-based communities. This facility broke ground in January of 2013. There are 300 people working on this site. 92% of the funds to build this hospital went to local businesses, and there's 31% DBE participation. We have hired executives to run this facility already. Mario Gana, who's standing over my right shoulder, will be the CEO to lead this hospital. Mario, it's great to have you, and thank you so much. Max Owens is going to be the Chief Financial Officer, and Mary Kelly will be the Chief Nursing Officer. This facility will be an anchor for development in the East, not only for healthcare security, but it will be the anchor for new businesses, retail jobs, in partnership with all of the other things that are going on in this area, involving not only the Walmart that's under construction down the street, which will provide another 300 jobs, but the Walmart that's going to be over 30 down in Gentilly. We also now have across the street a CVS that is open for business, and that is on top of the police station that was open, the $24 million of renovations at Joe Brown Park, and the $8 million of renovations that have taken place at the library. Major investments by the people of New Orleans in one of the most important neighborhoods in the city, and it couldn't have been done without these people standing behind us. I'm very excited about the future for New Orleans East, for healthcare and retail and jobs, and I want to thank all of the partners for their involvement. Before I turn the podium over to the following speakers, I do want to take a minute to tell you that leadership is critically important. The young lady standing to my left, who is our healthcare commissioner, has been scooped up by President Obama to help lead some of the national healthcare efforts, which is a tribute to the work that the people of New Orleans has done, Dr. Karen DeSalvo. I asked Dr. DeSalvo to come work for the city of New Orleans. She gave up a very lucrative position and in a very well-respected institution, and came. I asked her to transform the health department in New Orleans from a department that delivered services to a department that actually created better public health outcomes in the city of New Orleans. We now have a nationally recognized model in our health department. She helped us redevelop Joe Brown Park in partnership with Nike. She has helped put together the NOLA Fit program. She has helped us put together the NOLA for Life program, and has basically transformed the department in a very short period of time. I want to thank her for her leadership. She will be departing from us on Sunday, and Ms. Sylvia, come on in. And we will miss her dearly, and I want to thank her. She also has done something that all great leaders do, is they provide great transitions, and the transition will take place to Ms. Charlotte Parent, who will assume Dr. DeSalvo's seat on the board and become acting director of the health department. Charlotte is a New Orleans native. She was appointed deputy director in 2011. She has 20 years of nursing experience, over 10 years in healthcare management. She served as a director for maternal and child services at Touro Infirmary, served as a director of Healthy Start for New Orleans. She has been instrumental in the transformation of the department, and I am fully confident that she will do extremely well in the new role that she will assume. So I thank both of them for the work that they have done. And at this time, what I'd like to do is call some other folks up to make some comments. Council members James Gray and Cynthia Morrell, followed by Christy Nichols, Ronnie Burns, Mario, Sylvia, thank you for coming. It's nice to see you. Dr. DeSalvo, Charlotte Parent. And finally, I want to make sure that I thank John Finan, who unfortunately couldn't be with us today because of a tragedy, Greg Fern, and of course, a tribute to the late Alan Eskew, whose firm was instrumental in designing this. He passed away unexpectedly not long ago and is terribly missed by all of us in a very, very deep and sorrowful way. So I thank you all for coming.